Well, good evening, everyone. This is Dr. Rita Ellithorpe from Tustin Longevity Center here in Southern California. We are a group of 7 healthcare providers who have a lot of experience. Some of us a tremendous amount of experience with natural, complementary, alternative functional medicine. And we are training some younger physicians. We all have to learn somewhere because this really isn't formally taught anywhere. And we try and take the best of our natural allopathic medical training and blend it with functional medicine so that we can help provide to you and through this video service some of the ways we think about approaching with a functional lifestyle approach before maybe jumping into allopathic management or trying to avoid drugs or other interventional medicine if it's possible. We, of course, use drugs and other imaging and surgical procedures if they're necessary, of course, and refer to our consultants as needed. Now, we are not trying to replace your doctor visit here. We will answer generalized questions, but none of this is meant to be personal advice or management over the YouTube. So you can ask us email questions, which I get just minutes before the show to try and capture the latest entries. And we're getting more and more, and I'll try and go as fast as I can. But this is done as a service to you. And we hope that it's a benefit. But again, please don't use this as personal medical advice. If you're a patient here, please leave your physician a question about your personal care. If you want a general thought about approach, you can certainly mention it here. But again, don't see that as managing your case. If you are patients, please call the office. And that's 714-544-1521. You can leave a text message at that number or call. Anyway, so this is July 18th, 2023. And we do this every Tuesday at 6 o'clock in the evening to 7 o'clock. This is at the end of a very long day for me of working all day and being up since about 5:30 and with my workouts and everything. So I will try and be sharp, that's for sure. Sometimes it gets a little tedious certain days if it's a particularly hard day. And let's see, we might have a good joke or two for you. There is a chat here on the side. If you're on YouTube, you can type in your live questions and I will get to those. So I'll jump back from our emails here to the live chat over here. If you have our email, tlcdoctors.com, and you are getting the notification of these Ask the Doctor videos, there's a link on those emails. You can use that link to write us your email question. So for the live YouTube people who are here right now, Garden Fairy starts with a question. You and the KoKoro website mentioned to apply progesterone cream for 3 weeks and off 1 week. I'm concerned my mom is going to forget. She's 87. Is it better to have 1 week off? Garden Fairy, I would say you don't have to have 1 week off. No, it'd be just safe and fine if she continuously used it all the time. That's no concern whatsoever. And then the next one here, we have Cindy Love says, having sharp chest pains in the left side of the rib cage area once a day. Sharp pains come on suddenly and are triggered if I breathe too deep or cough or laugh. These pains last about 15-20 minutes. Cindy, I don't know how old you are. I don't know, because the older we get, the cartilage from the side of our rib cage to the sternum is just cartilage there from the rib bone. And as we age, that can get calcified. And so simple things like a cough can strain it, or a heavy lifting something, or a grandchild. And then we can get a little cracking of the calcified cartilage. And that can give us pain that'll take 10-15 minutes to resolve after we re-irritate it. But depending on how long this is, and if you have a particular cough that goes with it, now we all can have the occasional cough to clear our throat. But if you're having coughing, or certainly if you're having other symptomologies, you should see your doctor about that. Let them listen to your lungs, possibly do a chest x-ray. But very often, sharp pain is a musculoskeletal phenomena and not anything of real concern. Although, as there are symptoms where you can get fluid build up in the lung, and that can give you a drainage that kind of goes between the lung and the wall cage, so that that area there can get separated apart as fluid builds up. And this would have some sharp component to it. So it's best if you see a doctor, Cindy Levin, and let them check that out. Certainly if it's lasting more than a week or two, please have that checked out. Pamela says, what's a good calcium to take? What about spirulina, collagen supplements? Pamela, I don't believe it's right to supplement with calcium, because calcium should be plenteous in your diet, especially if you're eating enough fish or chicken or turkey or meat or shrimp or crab or lobster. It's tremendously abundant in our diet. Supplementation with calcium is, I think, a wrong direction to go. And there is research way back since the late 90s, when everyone's bone density was causing concern, as we were seeing the demineralization of our bones with aging, especially in women, and hip fractures. And so they started out with a recommendation of calcium, say 500 a week, a day. Then it went up to 750, then 1,000, then 1,200, then 1,500. And over the decades, it made no difference in the bone densities. So essentially, calcium supplementation is something I never recommend as a standalone item. It might be in a multivitamin mineral. It will be in a multi-mineral supplementation, but never standing alone. And we would recommend different things for bone density than giving calcium. So I don't recommend calcium supplementation at all. But if you have to ask what is a better type of calcium, it would be a chelated calcium, meaning it's connected to an amino acid, like calcium citrate, calcium gluconate, calcium sulfate, or these amino acid chelates. And Albion is the name of the company that is the best known for its high quality in making minerals for medical and food research, but don't use it separately. What do I think of collagen? Again, if we eat enough meat, fish, chicken, turkey, beef, shrimp, lobster, crab, pork, we're going to get tons of collagen in our food. And collagen can be and must be certain sizes to be absorbed into our tissues for incorporation. And a lot of junk cartilage is being manufactured and sold foolishly. So I don't support collagen replacement in general. It's very rare that I would ever recommend that. Things like spirulina, I don't believe in taking unusual supplements or juicing. I believe in eating whole foods. I am most concerned about marketing and packaging. Unless you know the manufacturer, some scientists there, I think we are in a world in which marketing and corruption in food services and lobbyists just to make a sale is a problem. We're seriously faced with corruption and industrial farming. So who knows that's really a high quality spirulina and so forth. So I don't go for any of these packaged green drinks or protein shakes or smoothies. I just don't believe in them. And then Rosa says, hello, Dr. Rita. I've just started taking medium chain triglyceride oils, and I'm wondering, is it okay to take them with dinner versus with coffee in the morning? Most definitely. Yeah, you could do it that way. Very safe. I was going to sneeze. All right, so let's get some of these questions here. I have many pages, so I'm going to be rushing through this, ladies and gentlemen. I know I didn't finish up last week, but I do the best I can, as this is a voluntary service we give to our friends and our patients and their families. So Don says, what's your opinion on advice that women should avoid water fasting during the week prior to their menstrual period starting? I don't believe that that's a necessary thing to avoid water fasting the week prior to menstrual period. The menstrual cycle is an inflammatory cycle of a woman's monthly phase, and that inflammation will only be helped with some fasting before it and plenty of water. So I think it's fine to do fasting. Number two, she says, for a woman who uses infrared sauna 4 times a week, should the sauna sessions be avoided while menstruating, or is it beneficial for dilating blood vessels? It's beneficial, and so I would feel very comfortable in doing that. Elizabeth says, hi, Dr. Rita. First of all, thank you so much for taking time out of your busy day to answer our questions. You're so appreciated. Well, Elizabeth, thank you for that. I appreciate you. First of all, I have ongoing issue with acid reflux. Is there anything you can recommend that will help? Yes, that would be our phospholipid powder with SBI Protect. I have a prescription from my gastroenterologist, omeprazole. That's a H2 blocker, which is not helping, and have developed a constant cough and congestion. I am 71 years old, a patient of Dr. Mitchell's, drinking my water, half my body weight, O negative blood type, exercise regularly. Thank you and God bless. So the lining of every cell in our human body looks like this picture right here. And when you get an injury, you're going to get this hole through the cell membrane, which is a single membrane. And that's made of fat and protein. And what we use here is we'll take phospholipids, and we will take this as a fat. This is the very same thing as this stuff here. And we will mix it with the immunoglobulin powders, SBI Protect. We put these two things together in warm water, say 6 ounces, and not hot water, but warm water. And I would drink that before you go to bed every night. And I would drink it probably first thing in the morning. And that will help fill in these holes here of the phospholipid damage and the protein globulins that make up this bilipid protein fatty layer. This always works. I really never had a patient who this failed me. So that's what I would do. Then sometimes people are helped with a glutamine powder product. L-glutamine is, as some of them have licorice acid, zinc, and vitamin A in it. It's called GlutaShield. And then there's glutagenic. So we have both of those here. It's just pure amino acid calming and acid. Then there are some that use L-carnosine. Ours is called Zinlori, taking a capsule once a day, and it's an excellent source of zinc supplementation too. You get 25 milligrams of zinc with it. So that's what I would say, Elizabeth. Give that a try and let Dr. Mitchell know. We're so happy that Dr. Mitchell didn't completely leave us to go to San Francisco with her husband's new job up there. And she was so happy to stay doing some work here, telehealth. And when she might be in the area visiting families, she might see some people. So we really miss Dr. Mitchell, but we're so glad she's still around, at least telehealth. Rhonda says, I am 64-year-old female patient with TLC and recently received x-ray results for my spine due to back and hip pain associated with scoliosis. The x-ray report also mentions atherosclerotic aortic arch. My primary doctor at Kaiser indicated that they use biometrics and that my risk of stroke or heart attack is a 1.8% chance, very low. So nothing more needs to be done, and that the condition is likely associated with normal aging. That's true. I am still concerned since there was no indication on the x-ray report regarding the severity of the atherosclerosis. Rhonda, you just got to believe what they're saying. I've been practicing medicine 42 years, and every time we take pictures, ultrasounds, you're always going to find little cysts, little tiny nodules, little calcifications. This is being alive, and this is being typical usage of the body. Should I be insisting on a referral to cardiology? No. And what tests should I pursue? Do you recommend lifestyle screenings or other actions? As for the scoliosis, I have dextroscoliosis of the thoracolumbar spine with a Cobb angle of 34 and levoscoliosis of the lower spine of 27. Again, Kaiser did not offer any services or solutions. What do you recommend? Thank you for your guidance and service. So, Rhonda, in general, just seeing a little calcification in the aortic arch on an x-ray meant to be looking at your spinal scoliosis is very common. So we usually don't pursue that any further. Talk with your doctor or see a functional healthcare medical doctor, naturopath, MD, DO, and get your insulin measured, get your fasting insulin measured, get your triglycerides measured, which are the first little fats you make from too many carbs. Get your hemoglobin A1C, that's glucose sticking to the protein hemoglobin. Get that number and get the fasting blood sugar. And so we can take your fasting blood sugar and multiply it times your fasting insulin. And there's an equation we can use to figure out your insulin resistance, which is far more predictive than any x-ray of your likelihood to be inflamed and have a poor metabolism and have disease ensue. So get those things tested and see your doctor about your x-rays. Regarding the scoliosis, the best thing you can do is to stay as young as you can with regard to stretching, Pilates, being well hydrated, taking systemic enzymes. I tell all my scoliosis patients that when you lean one direction, this crushes the pad of the spinal disc on the one edge, and then fluid is expunged out. And then when you come back, then it imbibes or sucks in by diffusion the water that you're drinking. So drink plenty of water every single day of your life, half your weight as pounds in ounces every day, so that when you're moving and stretching, your body is getting in the tendons and the discs between your vertebrae all the possible water it can get. And the older we get, the less we drink. You must just discipline yourself to get that number down your throat. Play a game with yourself and set out the water in a big pitcher or in bottles of water and knock them out like you're shooting them down every day. And then systemic enzymes like Vitalzyme or Vascuzyme are anti-inflammatory. That helps you with your range of motion. And then you need absolute weight training. And weight training is designed to help, build up your muscles, crunches, chest press, leg press, so that the paraspinal muscles there, the psoas muscle, all those little lumbricoides muscles that line your spine will be strong enough to hold you up instead of getting thinner and weaker with age and dissolving away, and you just kink into your scoliosis. So weight training twice a week, 20 minutes minimum, total body. I use the perfect workout myself 3 times a week all the time. And then Pilates on the rack, I forget what they call it, and have them do your twice a week, an hour. And then live a low carb lifestyle. Don't eat late. Get a good night's sleep. And I'm all for natural hormones and testosterone to help you with your muscle tension. So try and find a doctor that'll help you, Rhonda, with that. Joyce says, hi, doctor. I have questions regarding when to take supplements with a meal or on an empty stomach. Secondly, is there any drawback to taking supplements with a digestive enzyme if I take them with a meal? Thank you. Joyce, I take all my supplements. My pattern is I have, I don't know, maybe 15 different bottles I use, and some I'm testing. And I take them all in the morning. The only thing I don't take, and you know what, that reminds me, I forgot my thyroid. So I am going to say thank you. And I'm going to take my thyroid right now. And so, but I don't take my thyroid with my vitamins. And the reason is because that will generate maybe some calcium binding from the food I ate. But I don't want to take my thyroid too late. Okay, so thyroid medication should be taken an hour away from eating food. But I take all my vitamins in the morning in one big glump. And I take my thyroid with all my vitamins except for my multi-minerals. So if I remember to take my thyroid in the morning, I don't take it with the multi-mineral if I'm using a multi-mineral because the calcium in it, and I don't want to bind up my thyroid with it. So calcium, mineral supplements, and thyroid should be separated. But that's not too common. Don't worry about that. So digestive enzymes to help you digest your food are taken with the meal or after the meal. And systemic enzymes are taken on an empty stomach away from all the eating, at least an hour or two. And I would usually use it first thing in the morning as opposed to waiting an hour or two after a meal. It's much better first thing in the morning and last thing before you go to bed. Outside of that, you can take your vitamins all together and keep it simple. I don't have time to nitpick too much else. I just try and keep my thyroid away from my minerals. And I take my systemic on enzymes on an empty stomach, and I take my digestive with my food. And that's how simple it is. Oh, okay, we're down with one page. Page 2. Sabri says, my ALT, AST, those are liver enzymes, run high. What is a good liver cleanse? Thank you. I don't endorse any cleanses at all. I just don't, because I've been doing this 42 years and I don't see any sustaining value to them. Instead, what I do is I teach people how to eat and change their lifestyles. We're facing a boatload of marketing, propaganda. They spend billions on neuroscientists looking how to addict us by visual stimulation, smell stimulation, group pressure, on how to eat and consume their foods. And so you have to understand you are being manipulated through videos on the TV, videos on your YouTubes, your computers, your telephones and imaging. You're always being propagandized to respond to things, to buy things. And this is a multi-billion-dollar field for neuropsychologists, psychiatrists, neurosurgeons, all this kind of stuff, behavioral specialists. So please, I want you to understand learning to eat well and control of your own food rather than being influenced by social pressure or group pressure or your feelings. So we are made of protein, fat, and minerals and water, and that is what we should be eating. If it is a piece of meat, you know it's meat, it hasn't been handled, and now they're even messing with that concept with this fake meat. I mean, give me a break. So let's get away from the understanding that we need a cleanse. No, we need to live right. And we have to restore a true holiday or holy day to that statement, a holy day, instead of being trapped into thinking it's my sister's birthday, I'm going to eat junk food. It's my husband's promotion, I'm going to eat junk food with it. It's my cousin's this, it's my girlfriend's that, it's my work association did this. We can't live like that. So eat real food. And what's really hurting our livers today, the number one thing is fructose, hidden in high fructose corn syrup. And it is creating a strain on the liver, just like as if you drank alcohol, and creating inflammation. That inflammation hurts the what do you call it? The liver cell, and then the cells rupture, and you see these enzymes. So fasting is a wonderful cleanse. If you can learn to do intermittent fasting, where you restrict your food eating from, let's say, a 6-hour frame and then eat nothing for 18 hours, that gives your liver 18 hours every single day to heal and 6 hours only in which to eat. just start creating some rules for yourself. I tell my patients, I think about marriage and your vows in marriage and fidelity. You don't get married and put a ring on your finger and then you say, all right, I'll be married to you. But then you see some handsome male or female and you say, I'm going to sample that. And besides, it's a party they look fun. So I'm going to try them out and be intimate with them. No, you don't do that, even though you could. Okay. You don't do it because you live according to a principle about your personal life, your family, and things like that, and you don't want to commit adultery or even to your own body. So start putting up these ugly images about eating foods that you're being targeted and tricked into eating, and just say, no, that's going to be very bad for my body. Instead, I'm going to choose health and feeling great, and I'm going to choose the positive idea and take some water with a squirt of lemon in it. You just have to keep on fighting and do the self-talk and reprogram that propaganda that has snuck into your brain since childhood and getting cookies in Sunday school. All right, so I guess I put that to rest about what I think of liver cleanses. So there you go. Vanessa says, do you have any suggestions for a 77-year-old woman who has high cholesterol? Yes, high cholesterol is wonderful. High lipoprotein A, I don't really care about lipoprotein A, and some arterial calcification, but has been told to take statins. Thanks so much. Here's what you do. You go on the YouTube after you're done watching this, and you look up a video in the group videos run by Dr. Ken, K-E-N, last name is Berry, B-E-R-R-Y. And in that group of Ken Berry, there's a video called High Cholesterol is Healthy. So if you put in the top line there, high cholesterol is healthy, Dr. Berry, and then Dr. Diamond, D-I-A-M-O-N-D, PhD. They have a beautiful review that they just went up in the past month about all the current literature, and they do it in a manner and a teaching methodology that's so understandable. So please look at that, Vanessa, and check that out. We need cholesterol. In fact, there's tons of cholesterol in every cell membrane there. It will help the fluidity and the smoothness and the, so to say, the lubricating, molding ability of your cells. You have to have fat. We're made of fat and protein and minerals and water. And we eat fruits and vegetables for micronutrients, but you still can get all of them. And I mean that, all of them through a pure carnivore diet. Vanessa also says, hi, I have a family member, male in his 70s, that has a distended bladder. We're told once you stretch your bladder, it's impossible to get those muscles working again. Becomes like a sock that's lost its elastic. Do you agree with that? Or have you seen any solutions for a distended bladder? Thank you so much. Well, it takes a long time, but if you do intermittent fasting and autophagy can chew up some damaged areas and repair is still possible. We used to be taught the brain will not repair. Back in the 1970s, when I was in medical school and first starting to practice medicine, we were taught once you damage a nerve, that's it. Now we know today that that's foolish, that there is neuroplasticity. So I'm never going to say an organ has no hope. But you have to be working with a functional doctor who's going to test your insulin, because high insulins above a 4 or 5 fasting will prevent healing. A fasting blood sugar of 85 or less, a triglyceride that is equal to your HDL or less, and a hemoglobin A1C of 5.2 or less. Exercise, both weight training and aerobic, but emphasize weight training with aging. Enough water every day. Salt, your minerals. I use the Juice Plus series as my antioxidant. I use digestive enzyme with older adults, all of them, no matter what their blood type. And I use a B complex, and that's the bare minimum. And we do see that with bladder retraining. And so you can go talk to them about that. Vanessa also said, "Hi, Dr. Rita. I'm hearing a lot about black seed oil. What are your thoughts on that? There seem to be a lot of health benefits." Uh, the black seed oil has the omega-3 and omega-6, linoleic alpha linolenic acid, and so I'm fine with black seed oil. But we don't have to do these exotic things. It isn't like health or healing is an exotic mystery. Instead, health and healing is a disciplined lifestyle of eating real food God gave us, the meat, the fish, the poultry, the pork, the crustacean, shrimp, lobster, crab, and using the egg and the egg yolks, and then having a real whole piece of lettuce, cucumber, broccoli, asparagus, green bean, Brussels sprouts, that kind of stuff in moderation. And I prefer cooked vegetables over raw, and that's because of the lectins and a lot of the problems with food. Vegetables is a lack of cooking them and to break up some of their components, like beans in particular. Okay. Deanna says, "Hello, Dr. Rita. I'm a 28-year-old young woman, generally healthy, and currently 35 weeks pregnant. Congratulations, Deanna. I have a history of anemia, slightly lower than average iron levels. What vitamins or supplements do you recommend for postnatal care to replenish everything in my body lost or provided for my baby? Do you ever recommend taking reacted iron during pregnancy?" Yes, we have Hemavite. That is a chelated iron. We have a reacted iron here that we use. These are amino acid chelates to the iron. I prefer you eat organ meat, liver. I prefer that you eat red meat, and find out your blood type, Deanna. If you're a blood type A, I would take digestive enzymes, because it could be that you're just not digesting well, and you should see a functional doctor to look and see if you have a low-grade level of bowel wall. So the lining of your gut might have some low-grade inflammation from the corrupt foods, the grains and the dairy, and this creating some leaky gut syndrome. So see a good functional doctor to get that talked about. I don't know if you remember me, but I used to work for TLC briefly, but had to resign suddenly due to unfortunate family circumstances. I miss you in the office, Dad. Much blessings from my family to yours. Deanna, God bless you. And I'm so happy for your pregnancy. You know, I always tell people I met my husband when I was 16 years old, and then I married him when I was 17 years old. And I had no plan to be a doctor whatsoever. I wanted to be John's wife, and he was going to be a teacher, and I was going to help him and with children in the class and projects, and have his children and be a homemaker. But look at what life does: the Vietnam War and the terror, and him being on active duty. And my husband walked me over to the clinic. Walked me over to the university nearby the military base he was stationed at. And he just said, "You go to school. I promised your father I'd let you go to college." And I just, he got busy with all the Army stuff and, the Vietnam era. And then I just studied and studied and studied and studied. And long and the short of it, after, 10 years or so, finally 11 years, we had our first son. So God is in charge, and Deanna, who knows, what is, but I want to tell you that the greatest job for a woman, in my opinion, the highest job, is to be a mother and a good wife and a good daughter, and to raise up the children to be strong, God-fearing children, moral and loving, and seeing a stable family with moral principles, and that they can see their parents regard a authority over them. And it helps the child with her big questions about life. What's it all about? Why do we do these things? And we need to teach this to our children and see us live it out before their eyes. So Deanna, I am so happy for your pregnancy and God bless you. Wendy, my neurologist recently diagnosed me, a 36-year-old female, with cervical dystonia. Though my head does not twist or turn to any one side. The left side of my neck muscle does, however, appears to be slightly larger than the right side. Though it's not overly noticeable unless you're looking for it. So dystonia, all right, so that's very rare. I also suffer from migraines in general, and as a result of certain workout exercises, as well as tinnitus and hearing loss in my left ear, all for over 20 years. She suggested I try muscle relaxers or Botox to improve this condition. I'm not in favor of either of these options and would prefer natural treatments. I'm almost wondering if I should get a second opinion on this diagnosis because I don't look like the images I see when I search Google images on dystonia. But if my diagnosis is accurate, do you have recommendations for how to treat or manage this naturally? Would acupuncture or massage therapy be beneficial? Magnesium oxide, not magnesium oxide, that's a not an amino acid chelate, it would be like magnesium citrate. Fatty acids, I'd love to get your thoughts and opinions more holistically, natural treatment plan. Well, we have these patients who get in these much muscle twitch, these tics, this dystonia. Some of them are reactions to certain drugs. One of them is compazine that's often given for nausea. And it takes time, and it takes the muscle workout. It takes a clean diet, looking for any source of inflammation in the body, largely in the gut with the complete digestive stool analysis, looking for inflammatory markers in your stool. This can be activated or triggered by foods that you're eating through an inflammatory pathway that a breach in your gut system has caused. So we would do a complete digestive stool analysis, and we would look at your oxidative stress in a test called SpectraCell. Then we would look at your hormone and aging status, your protein status. We would give you a recommendation to do whole body resistance training twice a week, 20 minutes, upper and lower body. We would ask you to do a formal stretching program like with Pilates twice a week, the water, and we would give systemic enzymes and lots of them to replace the need for these medications of muscle relaxers. We would give a powdered magnesium drink with vitamin C powder. And then we would look at any other specifics of metabolism, and through enzymes, through weight training, muscle training that's balanced for posture and tone, for all these things. That's how we would approach it. And I don't know of a single dystonia we weren't able to work through. So we give the Lord all the thanks for that. So that's that one. So that's page 2. Yippee, yippee-yi-yay. All right, so it's time for a joke. Okay, so let's do a joke. Okay. Why should you wear glasses to math class? Why should you wear glasses to math class? Because it helps with division. Get it? Division. Okay. And the other one is, I know they say money talks. I know they say money talks, but mine always says goodbye. Praise the Lord. All right, Constance. Blessings. 2 questions. How long is it good to wear compression socks? My ankles swell up for only 1 day, maybe too much salt and overexertion. 2, my kidney stone has stayed at a 0.6 size, a small pea size for 9 months, painless. Is there any risk to get the sock wave treatment shockwave treatment, lithotripsy, and just continue drinking lots of water and exercise. That's what I would do. I would be extremely well hydrated. Try and reduce your body acidity by looking at the inflammatory things in your body that you may be eating and acidifying you, and oxalate foods. Look up oxalate-rich foods. Spinach is one of them. And these people out there taking these green drinks where they pulverize spinach and dehydrate it into these powders. It's like giving you, dozens of times the concentrate of a normal serving of spinach, rich in oxalates, and that will help you produce stones. So avoid oxalate-rich foods. Drink your water in ounces, which is equal to half your weight in pounds. And I would use systemic enzymes on an empty stomach once a day. Magnesium in a powder. We use OptiMag Neural, and that relaxes the smooth muscles. And you could do lithotripsy if there's any concern, but if they can check it by ultrasound, once a year and it's staying in the same place, don't worry about it. But, of course, that's my general advice to a general situation. I don't know your whole body and your whole situation, and you see your doctor about that. Because, for instance, if you are an insulin-dependent diabetic, the risk of, that stone becoming a site for infection is at higher risk. So I don't know these things about you. So you have to watch this with your own doctor, Constance. Sherry says, thank you for taking my question. My 84-year-old mother has been suffering from her scalp itching just in top of her head. We have been to dermatologists, and their shampoos and recommendations have not worked. We have tried olive oil, coconut oil, almond oil, but no result. She has stopped coloring her hair and is using henna instead. I don't know what henna is. She has been dealing with this issue for many years, but now it has gotten very bad that it is affecting her sleep. She keeps putting water at night to soothe the itch. We've tried everything. She started taking the 3 omega supplements, but really no success. Well, the skin membrane is made up of fat and protein. So the older we get, the thinner our skin gets. We lose our hormones, and the construction signal and repair signal diminishes, and the thin skin gets thinner, and it can get broken and scratched into much more easier, especially when we're brushing it and doing things to our scalp all the time. And we often bathe and shower too often, and we're drinking less water. We get soap, which also dissolves away the oils on the top of the skin and makes it easier to crack the skin for surface bacteria and viruses to penetrate in the cracks and create inflammation. So I would not wash your hair. I only wash my hair maybe once a month, and that's why I always wear it up, because I don't want, with my aging now hitting the 70s, I don't want to dry out and get all cracky and itchy. But there is the aging-related skin itchiness, and that's because we don't drink enough. We're thinning our skin. We don't eat enough protein and fat. And the oil I would take are these parent essential oils called clinician's preference oils. Clinician preference is designed, and I sought that company out in Dr. Peskin's, because we don't need we don't need omega-3s or DHA, EPA or DHA. What we can make them. What we need are the 2 essentials we can't make, called linoleic and alpha-linoleic acid. Alpha-linoleic is the omega-3, linoleic is the omega-6, and everyone's afraid of the omega-6. But the science is real. It's being suppressed. The only reason why omega-6 has a bad rap is because it's so needful and abundant in all your cell membranes. And when we eat meat, fish, chicken, egg yolks, these kind of things, it's rich, and some nuts and seeds are rich in linoleic acid, omega-6. But when they use it in making all these packaged foods, they have to hydrogenate that fat. So you have to look up an article. I don't have it with me right now, but it is on adulterated linoleic acid. Adulterated omega-6s are the cause of all this alarm about omega-6s, because that's what you have to do is hydrogenate the fats to create a package that'll sit on the shelf for a year without rotting. So we're not eating real food, people. We're not eating real food. And it isn't omega-6 that's bad. It's the damaged, processed, hydrogenated omega-6s. You must have omega-6. So to have healthy skin, well, what I would do is, and this comes in a liquid too, but you could just pop a capsule and rub this right onto the top of the head. Start wearing your hair up or with a hat on, and try and not shower or wash the scalp. Only use cool water and try and use the minimum soap. The only soap I would use is Selsun Blue, which with selenium in it to prevent fungus and bacteria. And I would try and wash her hair only once a week at most. If she can go every 2 weeks or once a month, that's even better. And the itching will improve with more water and a higher meat, fish, chicken, poultry, egg yolk consumption. John says, why is there only a 15-hour window of opportunity following administration of an EDTA chelation IV to pass heavy metals in the urine? Why is there? Well, essentially, there is, a half-life of that EDTA binding all the heavy metal toxins and peeing them out, and that's usually within 4 to 6 hours. After that, what residual is left is going to probably be all washed out within 15 hours, and that's because it's so water soluble. So that's why if you do chelation therapy, basically it's out of your system within 4 to 6 hours. And what's left over is going to be really all gone in the next maybe 8 hours. So you could easily do this twice a week or 3 times a week. Carl says, hello again, Dr. E. Couple for you today. Thanks as always for your knowledge and insight. Well, I thank the Lord for helping me. Your thoughts on consuming powdered whey? I don't like powdered proteins. I like eating meat. So I'm just going to be the old icky doctor and put my foot down and say, long and the short of it, unless there's some chewing or oral surgery or something that is requiring you to be on a protein powder, eat the real food. Cow and or goat, fermented or not. Of course, I'm taking a free-range grass-fed organic powder. Are you sure it is? Are you sure it is? I am so untrusting today of the food industry, the industrial food industry. And the more Bill Gates gets into owning farming land and the industrialization of food production. Does taking vitamin C increase intracellular glutathione levels? You can make a case for that. As a biochemistry PhD, I'm not a PhD in it, but if you go to a biochemist PhD, they're going to be able to connect all the pathways. Ultimately, everything does connect. So I'm not going to say no, it doesn't impact it. Because there's a lot of antioxidant recycling. The vitamin E will help recycle the vitamin C and glutathione and so forth in the body. So these are all patterns that are protective. Does EDTA increase intracellular glutathione levels? Well, we're going to say yes, because it improves circulation. Okay, now if we could get a fraction, even 1% of the tax dollars you pay to the government that sat on by Big Fauci's butt, and he doles it out billions and billions every year, and nothing goes to wonderful research like this unless there's some food industry benefit on it. So pure science is just not being done anymore unless poor doctors, old doctors like ourselves live near low middle income levels, and because we use our own money for this. And so shame on centralized government. Let's decentralize everything. All right. So yeah, EDTA will improve microcirculation, which will enhance all microbiologic functions, because you have better delivery of nutrients and removal of waste. Were you able to look into the supplement called Fatty 15 and the relevance and importance of its C15 fatty acid? And I have not. I don't know that I ever got to that. I'm going to write fatty 15, C15 fatty acid, check. And that's for Carl. So I'll check that out in today's date. See, you guys keep me, old Dr. Ellithorpe, educated. So I'll try to get to that. And then thanks again. Okay, Sharon says, milk, including lactose-free, gives me diarrhea. Is this an allergy or something else? How do I determine the cause? So Sharon, I would say it's probably also processing that it was pasteurized and homogenized. So what you're calling milk, I don't call milk. I call it a foreign substance you've been tricked into thinking is milk, and we're giving it to our children and in the form of cheese. And it's really a white fire drink, which is all inflaming. So I just have a more restrictive view of the need of dairy after birth outside of mother's milk. So if you're going to have milk, I would want you to know the farmers or check into them, call them up. We use organic pastures in California, Central California. We've had the owner of the farm lecture here. I know him, and I know their farm. We've been up there. And so I have a raw dairy farmer supply, and he brings it to Sprouts. So I get his stuff from Sprouts if I'm going to use something with dairy. But in general, no dairy. All right, and so let's go and see if there were any new YouTube questions. Okay, Pamela Covington says, I have osteopenia, so wanted to support my bones. Thank you again. Oh, so that's her comment on what she said before. Rosa Morales, my brother-in-law just diagnosed with prostate cancer and will start treatment soon. What do you recommend to help him before treatment? Well, we have a strong research support that fasting and getting your insulin as low as you can, say under 4 or 3 on a fasted blood sample, is going to stop stimulating it from growing any tumor, because insulin is a growth promoting hormone. And every potato, every rice, every bean, every tortilla, every cracker, every cereal, every banana, even thinking about these things for marketing can stimulate a neural gastric response and some insulin release. So an extremely low carb diet, fastings, intermittent fastings. I would do EDTA chelation therapy to improve the perfusion and the blood flow through the prostate. I would use systemic enzymes. I would use Vascuzyme or Vitalzyme on an empty stomach twice a day, 5 twice a day. I would use iodine, iodoral, 12.5 milligrams once a day. And I would stop all alcohol, because alcohol, like carbohydrates, stimulates insulin, but alcohol in a special sense, and fructose will also make more complex your detoxing and make estrogen rise, and estrogen stimulates through drinking alcohol the prostate growth. So that's what I would do, Rosa. Margaret says, struggling with bladder pain and sensitivity, also urgency and incontinence at times, but strained back in May and feel like something neurological, intensifying things, avoiding caffeine. All right, so you must be talking about your brother-in-law who had that bladder issue. Is that what you're talking about? But anyway, actually, lectins, food lectins, oxalates. I would go on an absolute oxalate-free diet. I would actually go carnivore, Margaret, if you're struggling with bladder pain. Do an absolute carnivore diet for at least 1 month and see if all these symptoms greatly improve. And that would be a very big tell for you. Debbie says, my grandson tested positive for TB and he had an x-ray today. What will an x-ray be able to determine? I hope it's not serious as he is trying to go into the army. No symptoms, but a recent cold. Well, of course, if there's active TB, you're going to see the lesions in the chest and the sometimes there's cavitation, cysts there. Hopefully none of that is there. But there is such a thing as just a skin reactive with no evidence of any active TB going on. Usually what they do is they'll give them like a 3-month trial of antibiotics designed to fight the cell wall-less tuberculosis infection, and it's usually a double or triple drug therapy, and that should be the end of it and not inhibit anything for him. Stephen Williams says, just got blood work, glucose 98, hemoglobin 5, A1C 5.3. Sure, diet 2 lax, will retest in 3 months. Weird result, testosterone went up to over 1,000. Well, that's wonderful, Stephen. Age 64 seems weird. It's not weird. It's because you're a healthier man and you live a healthier life. And men back in the 70s, when I was a young doctor, their cholesterol, their testosterones were in the 1600s, 15, 14, 1300 all the time. So no, that's not unusual. Looked it up, nothing conclusive I could find. Yeah, so I'm not worried at all about your testosterone. I'm proud of you because I know you, Stephen, and I know how you live your life, and it all reflects the anabolic life. You've cleaned up your body, you're healthier, and so you're not 64 or whatever your age is. You are biologically more like 50. Deborah Vishulis, my sister. Hi, my sister, Debbie. What is it? Oh, you have a joke. Okay. Where does a waitress with one leg work? IHOP. Where does a waitress with one leg work? IHOP. Oh, Debbie. Here's one more, Debbie. Why couldn't the Hawaiian lifeguard save the hippie? Why couldn't the Hawaiian lifeguard save the hippie? Answer, he was too far out. And then they had to notify his wife that he was lost. And do you know what his wife's name was? His wife's name was Mississippi. Mississippi. Oh, enough of this. Okay. Let's see. We're almost to the end here. Let me see. Dorothy says, been suffering for several weeks with fatigue and difficulty breathing. CT scan of the lungs showed fluid and mass. The fluid has been drained in the ER, but still waiting on an appointment with a pulmonologist for a biopsy of the mass. Even if it gets done this week, it could take another week to get results. Experiencing nausea, digestive discomfort at night when I lay down, and insomnia. Is there something I can be doing to help myself and help boost my energy, counter the nausea, and get a good night's sleep? I have been eating carefully, meditating, trying melatonin, which made me more nauseous. Any suggestion would be much appreciated. Dorothy, I would say fasting is the best thing for you to do for this right now until it's determined what this mass is. And I would try and do a 2-day fast with chicken broth and beef broth, and I would use some olive oil. If you have waves of hunger, you could have a tablespoon or 2 or 3 a day. And then when I did eat, I would eat carnivore, like I would have beef or chicken or fish or eggs and a little butter, salted. And then I would stick with a carnivore, and then the next day fasting, and then carnivore, and the next day fasting with the broth until you find out what's going on. Because the lower you can get your insulin, the lower you can get your blood sugar, and that will stimulate autophagy, which eats up junk. It'll stimulate your immune system, your white blood cell function, and it will give you mental clarity. So that is what I would do, and drink plenty of water and take systemic enzymes like Vascuzyme or Vitalzyme 5 or 6 twice a day on an empty stomach. Make sure you're taking your vitamin D 10,000, and you might take some vitamin C powdered, Vitality C with magnesium. OptiMag Neuro is the name of it. Mix the two together, the vitamin C and the OptiMag Neuro, as a nice drink. It'll give you a little bit of sugar, a little bit of energy from glucose, and you could do that once or twice a day. That'll also be very good. It helps the muscle relaxation with the magnesium. And then Dorothy had a second question. Oh, it was the same thing. It was just a duplicate on the same page. So that's done. Oh my goodness, it looks like I'm almost done. And it's already after 7, so I'm going to hold off my last few. Harlow, Dorothy, Desiree, Debbie, and Leslie. I'll just have to wait till the next time. I tried to go faster this time, and we'll work from that point. Okay, so I got all that. So God bless, and remember how precious your health is and how valuable family and friends are. And just treat each other with the best respect you possibly can, and yourself with great respect, because we certainly care about your outcome. And I will see you here next week at 6 o'clock. If this is of value to you, please like and subscribe. That will always help us. And God bless always. See you. God bless.